morning everyone. Myself Dr. Devashish Kundu. Today I am talking about kidney. Content: introduction, external internal feature, relation, blood supply, nerve supply, lymphatic drainage, and clinical anatomy. Introduction: the kidney are also known as renals or nephrons. The kidneys are a pair of excretory organs situated on the posterior abdominal wall, one on each side of the vertebral column behind the peritoneum, so it is called as retroperitoneal organ. Location: the kidneys occupies the epigastric, hypochondriac, lumbar and umbilical region. Upper pole is level of T12 vertebra and lower pole is L3 vertebra. Right kidney is situated 2 cm lower than the left. Size: a typical adult kidney is 4 to 5 inch long, 2 to 3 inch wide, 1 inch thick, about the size of a bar of a bath soap. On an average, the kidney weight about 135 to 150 gram. External feature: the kidney has reddish brown bean-shaped organ. Here we show the original specimen of kidney in the right side. We show that there is two pole. There is a superior pole and inferior pole, which we show in the diagram. This is superior pole and this is inferior pole. Two border, medial border. Here is the medial border. This is the medial border. And this is the lateral border. Two surface, anterior surface and posterior surface. There is the hilum, indentation at the concave medial border. This is the concavity of the medial border. Concavity of the medial border. Structure seen at hilum from anterior to posterior: renal vein, renal artery and renal pelvis. From deep to superficial, the covering of the kidneys are fibrous capsule, perinephric fat, renal fascia and paranephric fat, which we show in the next diagram. Here we show the capsule of the kidney. Here is the capsule of the kidney, then perinephric fat, afterwards renal fascia, and afterwards the pararenal fat, which is situated posterior to the peritoneum. Internal feature: a coronal section through the kidney reveals two distinct regions. One is renal cortex, another is renal medulla. So here is your renal cortex and here is your renal medulla. Renal cortex superficial light red area. The renal cortex is extending from the renal capsule to the base of the renal pyramid and into the space between them. Here is the renal cortex. Sorry. Here is the renal cortex. Extending from the renal capsule to the base of the renal pyramid. Those portions of the renal cortex that extend between the renal pyramids are called renal column. Here is your renal column. Here is the renal column. This one and this one. We saw in the diagram. Here is the renal column. Internal feature, renal medulla divided into renal pyramid 8 to 15 per kidney, base against cortex, apex called renal papillae. Here is the renal cortex and here is the renal medulla, where we show the glomerulus blood flow this direction. Afterwards there is a cortical nephron, juxtaglomeralar nephron, there is a collecting duct. All is situated in the renal cortex and mainly renal medulla. Okay. Here is the internal structure of the kidney. We clearly show where is the renal cortex. Here is the renal cortex. This is renal medulla. This is in between the two renal medulla. There is a renal column. There is a renal pyramid. This is renal papillae. This is the renal capsule. Here is renal capsule. This is the renal lobe, where consists of renal cortex, medulla. Okay, total thing is called as renal lobe. Here we show the minor calyx. This is the major calyx. This is the pathway of the urine drainage, where the collecting tubule collect the urine from minor calyx, then major calyx. Afterwards, the urine enters in the renal pelvis, then goes to the ureter, and afterwards into the urinary bladder. Okay. Internal feature, minor calyx, which we saw in the previous slide. Major calyx is one of the minor calyx, 2 to 3 per kidney. Major calyxes merge to form renal pelvis. Renal lobe. A renal lobe consists of renal pyramid, its overlying area of renal cortex, and one half of each adjacent renal column. Here we show the renal pyramid, renal sinuses, cortex. Okay. This is the relation of the right and left kidney. Relation of the right kidney anteriorly and posteriorly. Those structure or those viscera or those muscles are situated. Here we show the diagram in the anterior relation and posterior relation. Liver, duodenum, colon is the anterior relation. In the posterior relation, there is a diaphragmatic area of the quadratus lumborum. Different muscles are situated. Okay, inferior vena cava. And this is the relation of the left kidney, the suprarenal gland, spleen, stomach, pancreas, coils of jejunum, and posteriorly diaphragm, psoas, major, minor, quadratus lumborum, transverse abdominis. Here we show the diagram, anterior relation, suprarenal, spleen, stomach, pancreas, and posterior relation. Okay. Here we show the blood supply. The kidney receives blood from the renal artery, right and left, which branches directly from the abdominal aorta. Despite their relatively small size, the kidneys receive approximately 20% of the cardiac output. At or near hilus, renal artery divides into anterior and posterior division. Further branching give rise to segmental arteries, each of which supply one vascular segment. There is a vascular segment of the kidney: superior, upper, middle, lower, and posterior. Blood supply of kidney. Division of the renal artery. Each renal artery branches into segmental arteries, dividing further into interlobar arteries, which extend through the renal columns between the renal pyramid. The interlobar arteries then supply blood to the arcuate arteries that run through the boundary of the cortex and the medulla. Each arcuate artery supplies several interlobular arteries that feed into the afferent arteriole that supply the glomeruli. Blood plasma is filtered across the glomerulus into the glomerular space. Once the blood plasma is filtered, blood leaves the glomerulus, enter an efferent arteriole. Efferent arteriole is still carrying oxygenated blood. Here we show the diagram. There is the flow chart where the renal artery enters into the kidney after divided into segmental artery, then interlobal artery. Lobar artery means segmental artery divided into the different lobe of the kidney. Previously we see the renal lobe, which is called renal lobe. Then all the arteries are situated arch-like shaped, so this is called arcuate artery. Then interlobular artery, in between two lobes there is the interlobular artery. Then afferent arteriole, which is situated in the this diagram. Okay, afferent arteriole which is situated in the renal cortex. Afferent arteriole, glomerular capillary, and efferent arteriole. Then afterwards, peritubular capillaries, interlobar veins, arcuate veins, interlobar veins, and then renal vein. Blood supply of kidney. The afferent arteriole branches into one of two types of capillary network: peritubular capillaries, vasa recta. These capillary networks are responsible for the actual exchange of gases and nutrition. Peritubular capillaries, primarily in cortex, vasa recta surrounded the thin tubes that project into the medulla. Lymphatic drainage. The lymphatic of the kidney drain into the lateral aortic node located at the level of the origin of renal artery. Nerve supply, mainly renal plexus. Here is the applied anatomy. Congenital anomaly of the kidney. Normally we see the single renal pelvis, which is situated in the renal hilum, but there is some congenital anomaly where we see the bifid renal pelvis and ureter are fairly common. We see the right side, there is a diagram, bifid pelvis. These anomalies result from division of the metanephric diverticulum, which is we talk about in embryology. Bifid renal pelvis, ureter may be unilateral or bilateral. However, separate opening into the bladder are uncommon. Horseshoe-shaped kidney, where we see the lower pole of the kidney are joined with each other. In this disorder, the patient kidneys fuse together to form a horseshoe shape. During the development in the womb, the fuses part is isthmus of the horseshoe-shaped kidney. Renal calculi, we also know the kidney stone, also called kidney stone, solid concentration of crystal aggregation formed in the kidneys from the dietary minerals in the urine. About 80% of those kidney stones are found in men. Kidney stones typically leave the body by passage in urine stream, and many stones are formed and passed without causing symptom. If stones grow to sufficient size, they can cause obstruction of the ureter. Dietary factors that increase the risk of stone formation include low fluid intake, high dietary intake of animal protein, sodium refined sugar, fructose, grapefruit juice, apple juice, and cola drinks. Hydronephrosis literally means water inside the kidney. It refers to distension and dilatation of the renal pelvis and calyces, usually caused by obstruction of the free flow of urine from the kidney. Renal mobility is maintained in the normal position by intra-abdominal pressure and by their connection with the perinephric fat and renal fascia. Each kidney moves slightly with respiration. If the amount of perirenal fat be reduced, the mobility of the kidney may become excessive and produce symptom of renal colic cause kinking of ureter. the renal kidney trauma, well protected by the lower ribs, lumbar muscles, vertebral column. However, severe blunt injury applied to the abdomen may crush the kidney against the last rib and the vertebral column. Thank you very much. Please subscribe my channel and thank you. This is the model of excretory system where we show the kidney, ureter and urinary bladder. This is our kidney, right kidney and left kidney. Okay, this is the renal cortex, this is the renal medulla, this is the renal papilla, this is the minor calyx, this is the major calyx, this is renal pelvis, this is renal artery, this is renal vein. This renal pelvis connect with the ureter. This is right ureter, this is the left ureter. This is the outer surface of the kidney and this is the cross section of the kidney. This is the upper pole, lower pole. Here this is the upper pole, lower pole, lateral border, medial border. This is the hilum of the kidney. Okay, the right ureter, this is the left ureter, which connect in the inferior surface, posterior surface of the urinary bladder. Here we show the trigone. This is the called as internal trigone. Okay, and this is the urethra. So repeat this structure: kidney, renal pelvis, ureter, urinary bladder, internal trigone and urethra. Okay, here we show the female genital organ with excretory system. We also already know that this is the kidney and ureter, which is three-dimensional picture which connect with the urinary bladder. Urinary bladder looks like a quadrangular shape. This is the urinary bladder, quadrangular shape. Okay, connected with the urinary bladder in the posterior surface. This is the apex of the urinary bladder. This is the base of the urinary bladder, and this is the in the superior or posterior surface. There is the uterus, body of uterus. There is a fallopian tube. Here with the fallopian tube, and this is the femora and ovary. Okay. This is the vagina. This is the posterior view of the excretory system. This is the anterior view of the excretory system.